Hey everyone, this is our PI project, and my name is Brianna.
I'm Charis.
I'm Alexis.
And I'm Camryn.
So for our PR project, the setting that we chose was the Williams Adult Day Center, which is located in Winston-Salem, North Carolina. It was established in 1975, and it focuses on older adults with cognitive impairments like dementia or Alzheimer's. The Williams A Adult Center thrives to provide high quality of care to their participants.
So for the need, the current problem or situation is that there is no continued training, insufficient experience requirement, and a limited client-centered approach. And when diving into these areas for the no continued training, is that there's a lack of specialized training in Alzheimer's and dementia care, and that there's also no implementation of further training after they get hired. So that's a big issue that we discovered, as well as the insufficient experience requirement. So when we looked into that, the staff is only recommended to have at least 1 year of experience working with this population, but it's not required. So making it a requirement, I feel like would allow for them to have better training and for the clients to get a better overall quality of care. There's also a limited focus on client-centered approaches for the clients. And so having personalized activities is a big deal with this not just with this population, but with any population, especially this one. So the impact of the current situation on the stakeholders, and the stakeholders include the staff and the participants and/or clients. So for the participants, inadequate care, safety risk, and reduced overall quality of life. And then for the staff, potential for limited skill set, limited confidence, and missed professional development. So with the inadequate care, we kind of already discussed that, but the activities are just not as personalized and engaging. So the clients aren't really getting all that they could possibly get to help them get back to being a little bit more independent. With the safety risks, the dementia management could use some improvement. The inadequate training could increase the risk of mismanagement of dementia or Alzheimer related behaviors. And then going back to the staff, the impact on the staff, the limited skill set can decrease confidence and their ability to, work with this population, and also handling the care and needs of the individuals within this population. And then for the missed professional development, there's a lack of training opportunities. And with the lack of training opportunities, that could potentially hinder growth as an employee here at the Williams Day Center. And then lastly, this is kind of just reiterating, the problem and everything and why we need this, the overall need for change, so we can enhance their quality of care, increase their safety, and improve their quality of life for the clients. And those are the ones that are dealing with the dementia and or Alzheimer's. And then for the staff, increasing their confidence, extra professional growth, and then reducing burnout. Because if they're overall confident and wanting to work more and wanting to come into work and feeling good working with these clients, then we're hoping that the burnout won't come.
So, a little background on why we chose the Williams Adult Day Center for this PI project. So for one of my field works, I was actually at the Williams Adult Day Center, and while being there, I noticed firsthand that there were a lack of these needs that Cam just mentioned, that were really impacting the clients. So after kind of talking about this, we thought that it was a great idea to do our PI project on this to come up with ways to improve the quality of care, that the staff provide for the clients at the day center.
So for the pilot proposal, this would target the healthcare and activity staff at the center. So not only do they employ nurses and healthcare professionals, they also have staff that runs the activities at the day center that aren't exactly healthcare related. So it's important to also include the activity staff in the proposal. And then what exactly it is, it's just staff education. We came up with a training program that will work with adults with Alzheimer's and dementia. And then we will implement it at the Williams Adult Day Center. We're going to try and find a time for the staff to come either during their lunch break or not too long after they get off of work because no one wants to stay much longer than they need to. And then how will we do it? It'll just be a training program that they will be a part of. We'll have online modules that they will complete, and then once a month, they will come in for an in-person skills check, and it is implemented by the group of OTs. And how long it will be. So again, like I said, it will be once a month for 3 months, and then there will be a post survey after 6 months. So the pilot proposal for how much it will cost, I just kind of have a table here that I made with some rough estimates. For the healthcare and activity staff, we just kind of figured we would have the continuation of their hourly rate, whatever it is from the day center. I estimated $12 an hour. And then the team staff, we decided to do a package, including number of OTs, number of hours we're there, and then plus mileage for driving there. So with all of that for each person, it'll be about $245. And then the online modules will be about $15 to $40 per trainee. Equipment for the in-person skills check should be free of cost because the Williams Adult Day Center will have everything we need there. The program surveys will be free of cost. There's an online form that we can use for free. And then we want to have survey incentives just to try and get people to fill them out. So that'll be a $10 gift card dispersed to a few random trainees. So it's not going to every single person, but it'll be random to just try and entice people to participate.
So we have some situational factors that facilitate this service change. So we came up with enhanced quality of care. So the training will promote better participant engagement and safety, and it will create measurable improvements in care quality and family satisfaction. Then we said regulatory compliance. So the training aligns with the NC standards for adult day centers. So it providing an incentive to ensure compliance and maintain licensure. And then we said improve staff retention. So offering like professional development opportunities can attract and like retain skilled staff, and addressing ongoing like workforce challenges. And then we also said participant-centered focus. So just having a program that addresses the participants' unique needs and behaviors and positions the center as like a leader in dementia care, appealing to families and caregivers. And then having a cost-effective delivery, so just combining online modules with minimal in-person time makes the program like feasible without like significantly disrupting operations or requiring like extensive resources. So it makes it cost-effective. So now we have some challenges and barriers to this implementation. So the first thing that we thought of was like staff resistance to the change. So the employees may like resist participating in the training due to concerns about like the additional workload, lack of interest, or just being skeptical regarding its benefits, or they might even feel like they're already had enough like adequate training. So we came up with a solution kind of to like address this, just having clear communication of the program's values and offering the incentives. And then just having like professional development credits or like compensation for training time if we really need to go that far. And then for logistical challenges, we just said like maybe there might be like some scheduling conflicts. And it can be kind of difficult to coordinate like training sessions without like disrupting the staff responsibilities or their daily like operations. So some solutions for this can just include like flexible scheduling options or offering multiple time slots. And then we also do have that online portion. So they only have to come in once a month. So if they can just have like time slots, then it can make it a lot easier and it can work for everyone's time. And then financial constraints. So just developing and maintaining like the training program may involve like initial costs, such as the content development, technology setup, and then like the trainer fees. So to overcome this, we can just require like or try to get grants or just going over the budget again or just demonstrating a return on investment through improved outcomes and staff retention. And then for stakeholder doubts, so leadership and family caregivers may question the necessity or efficiency of the training. So just kind of providing like the evidence-based data. We can also give like the pilot results or like even having testimonials can highlight the program's like long-term impact. And then for retention, the staff may struggle to apply what they learn if the training doesn't like feel direct to their challenges. So to solve this, we could just ensure practical hands-on components like role playing or even having like scenario-based learning to make sure that they're actually like retaining the information that they're learning in the training. And then for sustainability, just making sure that the program remains like adaptive and relevant, requiring like ongoing updates, evaluations, resources, and we can just have regular feedback from the staff and the participants' family to help kind of identify the areas for improvement and maintain like the program's effectiveness.
So this is the logic model that we made, just following the arrows from left to right. We have our resources and inputs in the first box, which would be the training team, and then the staff activities. So we have the online program, and then the 1 day a month that they will be like confirming the understanding. And then our outputs, so that'll just be the staff participating in the training and then implementing the training while they are there at the center. Outcomes, we're going to hope that 80% of the staff report that they feel that their preparedness for engaging with the clients has increased. And then the impact will just be increased engagement between the staff and the participants. Hopefully that'll increase job satisfaction, so less people are leaving and more people are willing to stay for longer periods of time.
So with the value proposition, we said that the dementia training program at the Williams Adult Day Center will like enhance the staff competency and confidence in dementia care. So this can be really helpful because it can provide like staff retention and enhance the overall care experience for the patients at the Williams Adult Day Center. And just by focusing on this engagement and support, this can improve the quality of life for the participants. It also like gives satisfaction with care. And it also just aligns with like those NC adult day standards, just making sure that the staff are providing exceptional care and service for each client. And it just also provides the necessary needs for both the caregivers and the staff and just being supportive and responsive.
So for our outcome metric, so up here I have the timeline. So we're gonna do the pre-survey before the training, which is our baseline. The post-survey, we're gonna do it after, and then we're gonna do 2 different follow-ups. So one's gonna be a 3-month follow-up, and the next is gonna be a 6-month follow-up. And so for our data to be collected, we want to collect data on the staff's knowledge, skills, and confidence, the organizational metrics, and the client care quality. So for the staff, knowledge, skills, and confidence would obviously be the pre and post surveys, and then the follow-up surveys. And it's just measuring their confidence and their skill set improvements from when they first were hired, or if it's a current staff member before we implemented the pilot study. For client care quality, the client satisfaction surveys, and the direct observation of client engagement. So we would not necessarily interview the clients, but more so just see how involved they are from before the training and after the training with the staff members. And then for the organizational metrics, really just the staff retention, their satisfaction, and then the feasibility of the training implementation. So to measure that, we would look at staff turnover, satisfaction, and things like that, like how we had discussed potential burnout and trying to lower the potential burnout. What we expect the data to show is improved staff skills, better client care, and then higher retention of the staff. And then the relevance of the data is just to get the staff's performance, assess their training, and the impact on the training that it has on their competence and their confidence. And then linking the training effectiveness to the client engagement and satisfaction, and then as well as the feasibility. So ensuring that as we discussed previously, it can be sustained throughout the time there at the Williams Day Center if implemented again. And then just making sure that the staff, if there are areas for the staff to improve, we implement that as well.
Okay, so some lessons learned. So our understanding of this setting further allowed us to expand our knowledge on a deeper level regarding quality of care. This project shaped our insight on individuals with cognitive impairments, and the effects of the quality of care from the staff are truly impactful. Potential solutions can be tailored to the specific environment. Furthermore, understanding the law and regulatory standards of the adult day center shaped our understanding of how to carry out a solution. There are regulations and requirements to abide by such as staffing ratio requirements and scope of services in adult day centers. Implementation of a training program will be conducive for this setting to thrive. Above all, it would also coincide with setting values of teamwork and integrity. We talked about the effects of the turnover rate being an issue potentially due to the staff feeling overwhelmed. It is essential for staff to develop strong relationships with their participants at the Adult Day Center. And incorporating the training program can be done even if the facility environment evolves. So the program demonstrates cost effectiveness, and there's an incentive to encourage the staff to participate. The development of this program would assist with caring for large numbers of individuals with cognitive impairments, not to mention the extensive education for the staff to feel more comfortable and competent to work alongside this population. It is vital for the staff to recognize cultural humility when catering to this population and specificity for burden of care. All in all, this training program will focus on staff education to promote an encouraging positive state of well-being for participants.
So these are our references that I have here, and that is the end of our presentation. Thank you so much.
Thank you.
Thank you.
I can probably end recording.
How long was that?